All right, today we are diving into a true medical nightmare, acute limb ischemia. This is one of those situations where, for a doctor, everything else stops. It's a crisis where every single second counts.
So let me ask you a question. What actually happens when the blood supply, the oxygen and nutrients for an arm or a leg, just stops, like a switch is flipped?
Well, the answer is it immediately becomes a frantic race against the clock. The stakes are as high as they get. Save the limb, prevent an amputation, and in some cases, even save the patient's life.
Okay, so to really get a handle on this, we need to understand what's going on under the skin. What exactly is acute limb ischemia, or what doctors call ALI?
Here's the textbook definition, but look closer at the words here. Sudden deterioration and threat to its viability. This is key. We're not talking about a slow, gradual problem. This is an abrupt, lights-out kind of event. And this quote, wow. It really paints a picture of the worst-case scenario, doesn't it? A leg that is suddenly pale, almost white, cold, and just completely numb. It's an absolutely chilling image of a limb that's being starved of life. Now, something this catastrophic doesn't just happen out of the blue. It's almost always caused by one of two main culprits. Think of them as two different villains, embolism and thrombosis. So on one hand, you've got an embolism. The best way to think about this is like a traveling plug. A piece of a clot, maybe from the heart, breaks off and travels down the bloodstream until it gets wedged in a smaller artery. And because this can happen in a totally healthy artery, the body has no backup routes built. It's a complete disaster. On the other hand, you have thrombosis. This is different. This is when a clot forms right on top of an existing blockage, kind of like a clogged pipe that finally seals itself shut completely. It can be a little less dramatic because over time, the body might have already started to form tiny little detour vessels around the narrowed area. Okay, so picture this. A patient arrives in the emergency room. How does a doctor figure out what's happening? And fast? Well, it's like a high-stakes detective story, and they have a classic set of clues they look for. They're famously known as the 6 Ps. First, there's pain, and we're talking excruciating pain. Then pallor, that ghostly marble white look. Next comes paresthesia, which is that pins and needles numbness. If things get worse, that can lead to paralysis, where the muscles get weak. And of course, the doctor can't find a pulse, that's pulselessness. And the limb is perishing with cold. It's literally cold to the touch. Now, all 6 of those are bad news, but there are 2 that are just massive red flags. The second a patient starts losing sensation, or a doctor feels muscle tenderness, they know. They know the limb has just crossed over into critical ischemia. The alarm bells are screaming. So once the diagnosis is pretty clear, the next question is the big one. How much time do we have? And that leads to this incredibly important step, classifying just how bad the ischemia is. Because this is the window you're fighting against. In the most severe cases, you have about 6 to 8 hours before the muscle tissue starts to die. And once that happens, that damage is permanent. The clock is literally terrifyingly ticking away. So how do they make that call? How do they standardize the danger level to decide if a patient needs to be rushed to the operating room right now, or if they have a little bit of breathing room? They use a classification system, kind of like this one. If you look at the key signs column, you can see how it works. A class I limb is viable, no sensory loss, it's not an immediate danger. But check out the huge difference in class 2. A 2A is marginally threatened. There's a little sensory loss, but no muscle weakness. A 2B, though, is immediately threatened. You've got more sensory loss plus that muscle weakness we talked about. That's the game changer. By the time you get to class 3 with total numbness and paralysis, it's sadly too late. The damage is irreversible. And that's really the whole takeaway here. Class 2, that is the battleground. It's the moment where the fight to save the limb is either won or it's lost. And telling the difference between IA and IB determines everything that happens next. Which brings us to our final step. Okay, we have the diagnosis. We know how severe it is. Now what do we do about it? It's time to choose the right intervention to get that blood flowing again. Generally speaking, there are 3 main paths to take. You can use blood thinners like heparin to stop things from getting worse. You can go for traditional open surgery, or you can use newer, less invasive endovascular techniques. The traditional approach is open surgery. A surgeon literally makes a cut, goes into the artery, and uses a special tool, an embolectomy catheter, which is basically a long, thin tube with a tiny balloon on the end to physically go in and pull the clot out. It's direct, it's mechanical, and it works. The other option is the endovascular approach. So instead of cutting the artery open, specialists can thread a tiny catheter all the way to the blockage and just spray powerful clot-busting drugs right onto it. They're essentially dissolving the clot from the inside out. And this is where everything we've talked about clicks into place. The choice of treatment is dictated by that classification system. Remember that Class 2B limb, the one that's immediately threatened? That requires emergent treatment right now, no waiting. But a viable Class 1 limb, that might be managed more carefully, maybe just with medication to start. We're going to end on this really sobering but incredibly important quote. It's a reminder that this isn't just a plumbing problem in an artery. So often, acute limb ischemia is a sign of a patient's overall health, which might be quite fragile. And that larger reality, well, it changes everything. It changes the treatment decisions, and it can change the outcome in this desperate race against time. It's just a stark reminder of the incredibly complex, high-stakes world that these doctors navigate every single day.